Think about the holidays. You think about spending time with your friends and family, people that you love. You also think about eating the foods that you love, all those great memories. Well, you know what? To enhance those memories, you'd like to have a confident smile, a smile that you're proud of. And so let's talk about Freedom Mini Dental Implants. Dr. Regan Ackerman rejoins me once again. Okay, is it too early, Doc, to talk about the holidays? I don't think so.
Never too early. We've made it through Halloween. We're ready for Thanksgiving, although my kids are trying to go straight to Christmas. But I'm like, don't forget about Thanksgiving.
Well, you mentioned Halloween, and we know about, the dental issues that we have with all of that sugar. Here come the holidays. You want to, eat the foods that you love, and you want to feel good about your smile. So now may be the perfect time to give you a call.
Definitely, especially with Thanksgiving coming up. I feel like a lot of people that have dentures, this is probably the time they think about it the most, how they're struggling with their dentures. They're at a family gathering. They're trying to eat all the great food there. And it's not fun to have to excuse yourself and go reapply denture glue or, denture adhesive. So all those people out there that are struggling with dentures, please give me a call for a consultation, because I use mini dental implants. It's a smaller, less invasive implant, less expensive, and can get you out of using denture glue or even get you out of the denture completely. So now's the time to call, make the consultation. It's no charge, it's free, and then we can have you ready to go for your New Year's resolution.
There we go. I like this. I do think now is the perfect time, because you mentioned the fact, okay, here come the holidays, and if you've been a denture wearer for quite some time, don't go through this again, because every year I'm sure you've said, well, I wish I could eat that. Oh, I can't. Oh, I wish I could jump in these pictures and feel good about my smile. Oh, I can't do that.
Yes.
Don't go through that again. And for those who maybe want to see, am I a candidate? The good news is, and I don't mean to be repetitive, but it's free.
The consultation is free. It's no charge, and we take a 3D x-ray to make sure you are a good candidate for the implants. Because like I said, the mini dental implants, it's a smaller diameter implant, so I do not have to have as much bone. So if you were told you weren't a candidate for the big surgical implants before, or maybe that you had to have bone grafts or sinus lifts, I do not have to do that with the mini implants. So when you come for the consultation, we'll take that x-ray, make sure you're a candidate, we'll go over cost, if you need to look at a financing plan, we'll gather the information and get you ready to go, especially, if you don't want to do the treatment over the holidays. We'll have you ready to go in January for your New Year's resolution, to be able to chew again, eat again, taste your food again.
Yeah, let's say you're someone who is checked into procedure, surgical implants, and you said, that's not for me. It sounds way too involved. I've got news for you. It was. This is different. Let's talk about all the positives. You already mentioned not invasive. It's really simple. First of all, it works. It's just as effective, if not more. But talk about all the positives of mini dental implants.
Right. So the biggest thing is a lot less invasive. So when I place a mini implant, I'm not doing any incisions or stitches. I don't put you to sleep, no sedation, because it is minimally invasive. A lot of people are worried about their medical history, if they're on blood thinners or diabetic, still a candidate for the mini implants. I don't have to take you off blood thinners. So the biggest thing is a lot less invasive, and then a lot less costly. A lot of the treatment plans people come in with the surgical implants, I'm able to offer them a treatment plan a third to half the cost of a surgical implant treatment. So a lot less invasive, less costly, and then a lot less healing time. When I place an implant, a lot of times, you're either leaving that day with the denture snapped in, or just a few weeks later, you get your permanent teeth instead of waiting another 6 months or a year. The surgical implant process can take up to, a year or longer sometimes, and multiple visits back and forth, multiple dentists. So we just try to simplify things with the mini implants.
Yeah, and you really got my attention when you said, a third to half off of the old procedure. That is appealing, because again, holidays, everyone has a budget.
Yes.
So that's important. Okay, let's talk about how you accomplish this. So you always bring in models, because I think the reason why you get such a good response on this show is because a lot of people aren't aware of this. They think they have to go through all this rigmarole that was in the past, but I love the comparison with the way surgery is done now.
Yes.
If you had your appendix removed 20 years ago, then maybe it was, you have a scar and you could see. Now it's done with a laser, and this is similar. This is very precise,
yes,
and it works just as well, if not better. So
yes,
show them the model and how it works.
Yes,
a couple of ways, right?
Yeah, so I'll show kind of one of the most common things we do, which is what we call a snap-in denture. So this is a great option for people, that have a denture or know they are going to end up in dentures, and they don't want to have to use denture glue all the time. They don't want to worry about the denture flopping around anymore. So with the snap-in denture, so you can see these are the mini dental implants, And when I place these, I'm just numbing up your gum, a little local anesthetic or Novocaine, as you may know it. So, and I do not make any incisions or stitches. A tiny little hole made through the gum, place the implant, and then the great thing about this is the day I put the implants in, I can put these attachments inside your denture, and you will leave that day with the denture snapped on to the implants. So then you don't have to use denture glue anymore. Your denture is a lot more stable. You can eat better. You don't have to be self-conscious about your denture flopping around. You'll wear this denture 24/7, but you'll snap it out, rinse and clean it, and snap it right back in. So a lot less invasive, a lot less healing time, and a great way, you know, to make your denture a lot more stable, where you don't have to use denture glue anymore.
The other method is the one I really like, because if you want to get rid of all the plastic, and you can trim that back so that you taste a lot more of your food. But there's another method that is actually, you always say it's your third set of teeth. You have your baby teeth, your permanent teeth, and this is just like that. So this is borderline. This is, I'm not going to say it is life changing. It is. It is, like you said, the closest thing to getting your natural teeth back. So this model, this is what we call the permanent teeth, and when you do this, it gets you out of a denture completely. So we make this bridge of teeth, and you can see a lot less, you know, no plastic, nothing covering the roof of your mouth. And the way this process works is we're going to place the implants the exact same way, no incisions, no stitches, just a little numbing, and we're just going to put more implants in, kind of as many as the size of your mouth and your bone allows, and then we're able to make these porcelain teeth. So this bridge is a lot stronger than a denture, which is why it can be trimmed back to just teeth. And then this will get cemented or glued onto those implants permanently, so it does not come in and out. So just like you said, it's like getting your third set of teeth, so it gets cemented on permanently, but then you have nothing on the roof of your mouth. You get to taste all your food again. You lose all that bulky plastic of a denture, and you're going to brush this just like you would brush regular teeth. We give you a water pick to keep it clean. You get it cleaned every 6 months, just like you would regular teeth, but then you feel like you have your teeth back. You get to taste your food, chew anything you want, you know, just like having your teeth back. Yeah, and there's many of your patients, if you're wondering, you maybe think, okay, is the product durable? These are porcelain.
Yes.
And the implants are titanium.
Yes. So
it's very durable. How often do you see a patient after they've had these?
With the permanent one, pretty rare that, you know, we have any complications, because they're cemented, they're splinted, they're, you know, and a lot of people ask me if they're clinchers or grinders. They're worried about that. We give people like a night guard to wear at night and protect the teeth as well. All
right, Freedom Mini Dental Implants, and again, the consultation is absolutely free. Now is the time to call for that free consultation. Coming up here, we're going to take your phone calls. So if you have any questions, you're saying, you know, am I a candidate? I have some medical conditions. We'll talk about that with Dr. Regan Ackerman. 571-5263 for your questions. We'll be right back on Wave 3. Listen.
Coit deep cleans and disinfects your surfaces, air ducts, and more. We're here for emergency restoration, too. Call 800-4COIT to save 30% on select services.
The people you trust Coit.
I'm attorney Jim Desmond, and I only handle auto accident cases. This is my son Chase, and he's learning how to drive. My hope for you, just like my son, is that you will be safe on the roads. But in the event of an auto accident, just like my family, call me on my cell phone. Desmond Law is here to help.
This is Tom Drexler. Converting a bathtub into a large shower is a popular option these days for people who don't take many baths or have mobility issues. They're safe, easy to clean, easy to step into.
Dial 1 Tom Drexler, that's his number. Yeah.
Hey, I'm Joe Montana. When you get to be our age, you have little patience for nonsense and inefficiency. After years of practice, you become a pro at pretty much everything. So when I qualified for Medicare, I got WellCare. WellCare is no nonsense. They're pros at putting everything together to make things easier. Their plans include things like prescription drug coverage, dental, vision, and hearing coverage. It just makes sense.
Do you want a Medicare Advantage plan that just makes sense? Then be like Joe Montana and go with WellCare. WellCare can offer their members dental, vision, and hearing coverage to make things easier. It's a no-brainer. Go with a no-nonsense Medicare insurance provider. Call for a free WellCare guide today.
Hi, I'm Mark Krish of Coit Cleaning and Restoration. Over 70 years ago, we pioneered the cleaning business. Today, we continue to deliver exceptional services guaranteed in writing. Right now, save 30%. Go online or call us today.
Freedom Mini Dental Implants, Dr. Regan Ackerman. Again, if you have any questions, 571-5263. Okay, we talked about the procedures that you offer and how easy, and that the consultation is absolutely free. But I don't think anything speaks better to what you do than the people who are the before and after pictures.
Yes. Yep.
So you have one for us today. I'm looking forward to this.
This is Jim. He came to me like many people. His teeth were just failing him, and he knew he needed to have his teeth taken out. He had done everything possible. I see so many people that are embarrassed or ashamed to come in, and that is the last thing you need to do. You know, I see so many people that have struggled to no fault. You know, they've done everything they can. So Jim came to me. His teeth were breaking on him, and knew he had to have all his teeth removed. So we ended up doing snap-in dentures for him. And there is Jim today with his nice, beautiful smile.
He looks like his younger brother.
Yes. So, and you can tell that first picture, you know, it was hard to get him to smile. You know, it was a little strained. And now that he's got his snap-in dentures, I think he's definitely more confident. I'm very happy he did the implants and that they stay in better. He can chew. Very pleased with the snap-in dentures.
So for folks who have dentures currently and they've been struggling with those, with the glue and all that, they are ready to have Freedom Mini dental implants. Now, from what I understand from what you told us, Jim needed to have his teeth pulled first.
Right.
But now is a good, if you happen to be like Jim, now is a good time to have the consultation now, and then if you want to wait till after the holidays to do the procedure, but the consultation now is a good time, right?
Yes, actually I think this is a great time for the consultation because a lot of times we'll make dentures for you before you have the teeth taken out, so we can be getting those impressions, we can be getting the dentures made so that when January hits and you're ready to have your teeth removed, we've got your dentures ready and everything is set up, your appointments are set up and ready to go. Like I said, if it's your New Year's resolution. So don't wait, you know, till the new year and you're like, oh, I'll do it next year. Do the consultation now, you know, November, December, maybe you have some time off, free time, come in for the free consultation and we'll go over, you know, cost and the process and get things ready so when, you know, New Year comes, you're ready to go.
Yep, and if you have any questions for Dr. Ackerman, it's 571-5263. Okay, I'm curious, what was Jim's goal when he came in? Was it about confidence in his smile? Was it that he felt like, okay, I'm not really, not only is it I don't like my physical appearance, but because my teeth are failing me, I'm hesitant to eat foods, afraid a tooth will break or whatever. What was his issue?
So function. He knew all his teeth were fracturing and breaking, and he knew that he was going to end up in dentures. And like many people, they do not want regular dentures because they've heard all the stories about the glue, especially the lower denture. It flops around. Nobody can keep it in. And so he knew he needed a better option than regular dentures. So he was preparing for the future. When he came to me for the consultation, you know, he already knew he needed dentures. He just wanted a better option. So he chose the snap-in dentures. A lot of people choose the permanent teeth to get rid of the denture completely so that they can, you know, still taste all their food and they're just, you know, cemented in there. So for him, it was a function. And a lot of people are, you know, struggling like him and they're trying to keep their teeth as long as they can and they're hurting and they're painful and they know they need to have them taken out. But with the mini implants, I can give you a much better option than regular dentures.
And again, the consultation is free, so why not check it out? If you have any questions, of course, financing is available. And it's not just for those who maybe want to throw away the dentures. I think that's a lot of what you do, but perhaps you had a genetic defect and you're missing a tooth, or perhaps you had an accident, whether it be in a car or a sports accident, softball, baseball. If you have single teeth that you say, I'd like to replace that, I'm tired of this, you can do that as well, right?
Yes, yeah. I'll go ahead and show that model now because it doesn't have to be the whole mouth. If you're missing just one tooth in the front, you know, a lot of people had a sports injury or trauma or were born without a tooth, we can do a single tooth with a mini implant as well. So same process, no incisions, no stitches. We place the implant. A lot of people that are missing a front tooth like this, they may be wearing a flipper or a partial. The day I put the implant in, you will get rid of that flipper and partial, okay? And then you do not have to wait 6 months to a year for your final tooth. But once that implant is placed, then we have the nice porcelain tooth, and it is cemented on to that implant permanently, so it doesn't come in and out. And same thing, a lot of people are missing their back molar teeth or multiple teeth. Even if you're missing 2 or 3 teeth, we can replace those as well with the mini implant. Same process, no incisions, no stitches. I'm going to place the implants, and then we'll have a bridge of teeth, and then that gets cemented on permanently. It doesn't come in and out. So I had a patient say it was like she grew her tooth back. But you get rid of the partial, you get rid of the flipper, whatever it is you may be trying to wear to replace those teeth, you'll get rid of it the day we put the implants in.
All right, let's go to the phones. 571-5263. Any question you have for Dr. Ackerman, she's heard them all, and she'll address those. We go to Bridget, who called first. Bridget, thank you for watching and calling. You have a question for Dr. Ackerman?
Yes.
Hello?
Hello.
Yes.
I was wanting to know if I had teeth that need to be taken out. Would y'all do that also?
So that is the only thing that you won't do at our office is the extractions, having the teeth taken out. We still refer to an oral surgeon for that. Mainly if you're having a lot of teeth taken out, a lot of people want to be sedated for that. So we still do refer for an oral surgeon for that, but that is the only appointment that you will not have at our office. Everything else is done, I will do at the office. I take impressions, make dentures, do the implants. Everything else is done in my office. So great question. Thank you.
Thank you, Bridget. If you have a question, 571-5263. We had someone who called who had a question. They did not want to go on the air. I respect that. They were wondering, do you ever close gaps? Like if someone just has a gap and they're going, okay, there has never been a tooth there, but I have a little issue here. Can you help them?
Yes. So it kind of depends on the situation. I would definitely advise for a consultation so I can see the exact gap. But if it's a gap from a missing tooth, certainly. It just depends. Sometimes, if it's a gap in the front, if the tooth is good, you may need to keep that. But it just depends on the situation. But I've definitely closed lots of gaps in my career. So, yeah, I definitely invite that person to make the consultation so I can see exactly what they're talking about.
Yeah, and again, I can't stress this enough. The consultation is free, so it's worth your time to go there. It doesn't cost you a dime, and then you can weigh your options, ask questions personally to Dr. Ackerman. But if you have one today, 571-5263. We're going to take a little bit of a break. We'll be back with Dr. Ackerman with more of your questions, and also maybe we'll talk a little bit about sports accidents, and can she help in that regard? We'll be right back.
To be at a Swope family dealership, for me, it means a lot with the legacy of the Swope family.
It's very gratifying for me to be involved in a business where the culture, which was established by my father and my uncle, Sam and Bill Swope,
the way that we treat people is at the forefront of what we do with both the associates and our customers. That's one of our greatest strengths is the people that are here. That longevity of that team creates a different experience for the customer.
Belly pooch, muffin top, back fat. Sound familiar?
Stubborn fat is not your fault. We can help you here at Sonobello by permanently removing that stubborn body fat.
It's not just about inches lost, it's about changing people's lives and giving them the confidence they deserve to have.
Sonobello is America's #1 cosmetic surgery specialist, with board-certified surgeons who are dedicated to transforming lives with permanent fat removal in just one visit.
We're the leading experts because we are passionate about what we do. Wherever there's excess fat, we can remove it.
At Sonobello, we're here to help you reach your goals so that you can live your life to the fullest.
Schedule your free, no-obligation consultation now and find out how you can get $250 off instantly. Call 1-888-256-8938 or go to sonobello.com.
A message from Mike Sullivan.
Hey, Dana, I'm making a face talk.
Get back to work. This happens every time he takes time off.
I think maybe this is defective or something.
Legal experience matters. Just like an instrument, it can take years to learn a new skill. Call me for your disability case. I promise, no music.
Call 888-587-0228. Call now.
We have talked about all the positives of Freedom Mini Dental Implants, all the pluses, and I'm trying to think about if there's any minuses. It costs less, it's less invasive, it's quicker, no more glue, throw away your dentures. What are the negatives? Help me.
There's not a lot. There's not a lot. So, and you're right, though. So many people haven't heard about this because either their dentist, hasn't done the training or doesn't know about it, or they've had dentures for years and they haven't been to a dentist and they didn't know that this option was out there. So there's a lot of people, that didn't know this option was out there, which is why, I like to be here and spread the word. Or they were told they weren't a candidate for a surgical implant before. Like I said, they may not have had enough bone or needed a sinus lift or a bone graft. And a lot of times you can still be a candidate for the mini implant if you were told that before. So please make the consultation. We'll take that 3D x-ray and confirm that you do have enough bone. It's pretty rare I have to tell somebody they're not a candidate for a mini implant. I'd say 90 to 95% of people that walk through my door are candidates for the mini implants.
Yeah, because you don't need as much bone at all.
Exactly.
So if you've heard that previously, this is a different story.
Yeah.
Well, let's go to Rick, who has a question for Dr. Ackerman. Rick, welcome to the show.
Thank you.
Hello.
Hello. I've had all my teeth taken out except for 4 at the bottom, which I have snap in with the spring-loaded dentures on the bottom. It's the top that bothers me.
Mm-hmm.
And on that, I just don't like the roof part of the denture, the full dentures at the top. Would that work for me where you don't have to worry about,
yes,
that top part not bothering me anymore?
Yes, and you are not unlike so many people that have dentures and they hate how it covers the roof of their mouth. So, both options would actually get you in a better position. Even with the snap-in denture, once I place the implants, I can trim that denture back some and relieve some of that off the roof of your mouth. The best option would be the permanent teeth. Just use more implants and then you really have nothing on the roof of your mouth. So, please, make an appointment for the consultation and we'll go over both those options with you and you can kind of, look at the pros and cons of each option, but it could definitely, be able to trim back some of the roof of the mouth, which is one of the biggest complaints about the denture on the top. So, yes. Great question. Thanks for calling, Rick.
A really good question, because I would think someone who, if you have dentures, you probably come so kind of accustomed to the new norm. And I would think, I talked about being life-changing, being able to taste more of your food.
Yes.
I mean, do your patients talk about that as like, wow, this is amazing. I wish I'd have done this before.
Oh, it's life-changing. And they're not tasting denture glue anymore, because that used to be what their food tasted like, is denture glue. So, and even people, a lot of people struggle with gagging because of that denture on the top. So when I'm able to place the mini implants, even with the snap-in denture, I can trim that denture back some so you don't get that gaggy feel anymore, and you can actually keep your denture in. So it's life-changing. A patient right now comes to my mind where, she could not wear her dentures at all because they just gagged her. Even the bottom ones gagged her. And we were able to do mini implants, the snap-in dentures, and trim them back enough for her that where she now has dentures that snap in and she can tolerate them and keep it in her mouth, and she's not gagging, and she can smile and eat again.
And the consultation is absolutely free. We mentioned the timing. Now is the perfect time to have that consultation. If you decide, hey, I want to wait till after the holidays, the consultation is still great. Wouldn't it be nice going into the holidays knowing, hey, when this is over, I'm taking care of this?
Yes.
So the consultation is absolutely free. If you're wondering, is this too good to be true? It is not. Freedom Mini Dental Implants will show you why she needs less bone here in a second. But first of all, let's grab another call. Pam was nice enough to call. Pam, welcome in. You have a question?
Yes.
Yes. Go ahead, Pam.
Yes. I already have implants. One is permanent, one is not permanent. They're snap-in. I'm not particularly happy with them. Can they be replaced and redone?
So great question. Usually yes is the answer. It all depends on what type of implants they were. You know, the snap-in ones, if your implants are good, sometimes it's just a matter of making a new denture or bridge or whatever that appliance is, or converting them to the permanent teeth. I've had a lot of patients that have had, you know, surgical implants before, and we've added mini implants around them and then been able to give them the permanent teeth that are cemented on. So definitely invite you to do the consultation so I can see exactly what type of implants you have in this scenario. But, you know, usually, yes, there are ways that we can, you know, either change the denture that snaps in and keep the implants that you have if they're good, stable implants. But if we need to add more implants, sometimes we can do that as well.
Yeah, and they just need less bone in the former method. So again, because of that, you can probably make, you know, not only improve what they had before, but also if they've been told no, then that's not going to happen.
And a lot simpler experience. So I'll show this model real quick because this kind of speaks volumes for the process. So let's see if we can get, so the little hole down here, I'm going to cover up the big hole. I don't even know, the little hole, that is the hole that I make when I place an implant. Yes, so you can see I do not have to have much bone versus this bigger hole, which is, you know, the size of a surgical implant. So they need a lot more bone. They make an incision, but with the mini implant, that is my little, you know, starter pilot hole. So I do not have to have as much bone, which is why so many more people can be candidates for the mini implants that weren't necessarily a candidate for the surgical implants.
And the consultation is free. Okay, with our last 30 seconds or so here, can we take a look at Jim again? Because
Certainly.
This makes me happy.
Yes.
So again, Jim, hey, was he apprehensive at all? Did he hear good things? What made him come into your office?
So I think we were talking about this when he left the other day. He saw me on TV just like this. And there's so many people that are like, you know, I saw you on TV. I'd say 90% of the people say they saw me on TV. So don't hesitate. Please call. That's why I'm here, and do the free consultation.
Yep, free consultations. Again, there's the information. Call that number, that 937 number, because it is absolutely free. And get this done before the holidays and feel good knowing that you're going to take care of your smile. You're going to be confident, no more denture glue, and also eat the foods that you love. Thank you so much, Dr. Ackerman.
Thank
Appreciate
you.
it. All right, coming up here, we've been talking about today is U.S.